Hi, I'm Dr. Seth Force. I'm the Kamal A. Mansour Professor of Surgery and Chief of the Section of General Thoracic Surgery at Emory University Hospital in Atlanta. Questions often come up surrounding surgery for advanced stage cancers, and that would include stage 3 and stage 4. And there is no definite answer for when and if we operate on those patients. So the reality is, yes, we do operate on patients with stage 3 cancer and even occasionally with stage 4 cancer. But they're in very specific situations. And the reason being that there is not definitive evidence to suggest that surgery always provides a survival advantage when it's added on to chemotherapy and radiation for patients with advanced stage cancers. So in these situations, it's critical that there's a multidisciplinary team and discussion to plan these patients' treatment because it's very complicated. So for example, in a stage 3 lung cancer, yes, we will operate, but in specific situations, and typically, not always, but typically it's after giving chemotherapy or chemotherapy and radiation to make sure that we can shrink the cancer, reduce the cancer burden in the lymph nodes, and then go and operate. And if you can, what we say, sterilize the lymph nodes or remove all the cancer from the lymph nodes with that treatment, then those patients tend to have a very good prognosis and even better than your standard stage 3 lung cancer patient. Just to give another kind of personal example, another patient I operated on this past Monday, he was diagnosed with stage 3 lung cancer about a year and a half ago and elected not to have surgery. So he had chemotherapy and radiation. And over the last 16 months, his lymph nodes were all fine, but the tumor started coming back in the lung. So I took him to the operating room on Monday and removed the upper part of the right lung where the cancer was coming back and all the lymph nodes. So that's just an example of, yes, we do operate on patients with stage 3 cancer, but it's not always the primary treatment. And there's got to be a very good plan surrounding who and when you operate on.